All right. Hi, everyone. Welcome to Webinar Wednesday. I'm Carly Andrews. I'm the Outreach Coordinator for the North Dakota Brain Injury Network. We've been doing these webinars for coming up on a year, I believe. But they started out as a collaboration with ourselves and the American Heart and Stroke Association because in 2019 we actually got legislation passed making a stroke a brain injury or adding to the definition so we can be inclusive to all types of brain injury. So we do have these archived on our website. If there's more you want to see, please go look at those. If you also have any ideas for any future topics or speakers, please let me know. My email, carly.endres, E-N-D-R-E-S, @und.edu. Today we have JoLynn Pennington. She has Health with Jo, and their motto is great, helping people feel better through health and wellness. So we thought we'd bring her in to kind of explain what she does today. So I'm going to turn it over to you, JoLynn. Welcome.
Thanks, Carly, very much for having me. I'm excited to share the information that I have. Talking about Brain for Life, we want to definitely make sure that that's intact through our whole life. And I know with brain injuries and things, it does get difficult to make that happen. So I'm going to try to share today things that I know that may help. I'm in no way a health provider. I am a health coach, a wellness coach. I talk to people individually, one-on-one, about products that I have, but I no way am a health provider in any means, and I want people to understand that. Statements here have not been evaluated by the Federal Food and Drug Administration. The products that I have are not intended to diagnose, treat, cure, or prevent any disease. So with that being said, my day job is a legal assistant. I've been doing that for over 30 years, 26 years at the job that I'm at now. But a couple years ago, I fell in love with some health products that were really helping me feel better as it came to inflammation in my body and knee pain. And I started learning more about them, and I realized that I'm able to help people more one-on-one than just sitting in a law office. And so I wanted to get out there and share the product. So this is what I do on a part-time basis, but sometimes it tends to be more full-time. Today we're going to be talking, of course, about a brain injury and the things that we need to do or we need to think about when someone comes in with a brain injury. There are at least 1.4 million people that either die or are treated in a hospital or emergency room with a TBI. So it's definitely a serious problem that we're dealing with in the US, and it contributes to lots of cases of death and permanent disability. I was surprised to learn that according to the CDC, there's that many concussions a year. I guess when you take a look at all the sports, things that go on, and you realize that it's definitely something that is a possibility. I was surprised when I started looking for pictures. You don't think about all of the ways that an injury can happen to you. And really, it's just not the athletes. They tend to have a majority of the concussions, but they're not the only ones at risk. I mean, we're dealing with older people that fall. We're dealing with car accidents, child abuse. Children tend to be some of those that have concussions most. And then we're dealing with the military, the things that they go through, the PTSD that they have, and the brain injury things tend to overlap. And I'll show you that in a slide later on. But I have a friend who is a health provider, and she fell and hit the back of her head and had a very serious concussion. But with the help of some of these products, she returned to getting her memory back and quick thinking, which it took her a while, but in a couple months, and now she has 2 clinics thriving, that she's helping other people deal with not only concussions and brain injuries, but dealing with kids on the spectrum as it relates to their brain health. The effects of brain injury are huge. It affects so many things in our well-being, between cognitive, physical, and emotional. And it's really important, I think, that the TBIs are treated ASAP, because without that, the recovery definitely can take longer, and people that are recovering are at higher risk of having a second, more serious injury. I have some post-concussion therapy here. It's easy to see when the heads collide that there can be issues with the vertebrae that are in the neck, and once they malposition, it causes that abnormal flow to the brain, which is going to affect the brain itself. This was posted by Dr. Deidre Mason. She is the director of our company for clinical education. She's a licensed naturopathic physician and lifestyle medicine practice since 2000, and she really emphasizes complementary approaches to chronic disease, and she understands and definitely shares her knowledge with us. So according to her here, it's very important that we get those the arteries in the brain primary blood supply to deal with the concussion. As I said before, a lot of the PTSD and TBI symptoms overlap. In particular, you can see the ones in the middle there: irritability, cognitive deficits, insomnia, depression, fatigue, and anxiety. I was surprised to learn by that, but I did know that some of our products that we have been known to help individuals with PTSD. And so I would like to be able to get myself up into the Minot Air Force Base and be able to talk to some of the individuals up there and hopefully help them as they're dealing with their injuries from combat, probably brain injuries as well, but the PTSD that they have because of it. It's like, where do we go from here? Where do you start? What do you think about other than diagnosing that TBI as it comes in? A moderate or severe TBI can lead to a lifetime of physical, cognitive, emotional, and behavioral changes in the body. I have to say that the biggest, the top of the list for brain health is going to be the omegas. We have, our omegas have vitamin E oil in them, and it is great for an anti-inflammatory, which you want that brain to reduce the swelling, and it's going to improve blood flow to the brain. What makes our product a little bit different than regular omegas that you can buy over the counter is that we use fish that are small, from like sardines and anchovies, and so they have a short life cycle, which really makes them ideal because they have less toxins in them. Or if you're buying products perhaps from other stores, they tend to use the bigger fish, and those tend to accumulate toxins more than the fish that we use in our processes that we use. The second big player, I think, for people with a brain injury in using the products that I carry is our Isotonics OPC3. That is a huge anti-inflammatory. It has pycnogenol in it, which is it's taken from pine bark extracts and citrus, and it's such a powerful antioxidant. And studies have shown that the OPC is 20 times more powerful than vitamin C and 50 times more powerful than vitamin E. It definitely neutralizes those free radicals that are running around in the body. And the company here, we have the sole right to use it in an isotonic form. I'll explain later what isotonic means, but the ingredients in the product, they also increase the blood flow and lower the blood pressure. So it rapidly can absorb in the system, and it helps with the relaxation of the arteries, and the diameter of the blood vessels. So extremely important when you're dealing with a head injury. And I've kind of got my top 3 here that I think are extremely important. The next product would be, it's called bromelain, which you know is the pineapple. There is a unique combination in bromelain that promotes our body's immune and inflammatory response. So it helps the body heal itself on a secular and a muscular level. In addition to, you know, healthy joints and things like that, it also promotes healthy blood circulation and in our bodies, and it makes the cells normally detect by the immune system when they try to disguise themselves. So it really attacks and tries to heal, help the body heal itself. So I think with the use of omega and OPC3 and bromelain, it's really the trifecta of trying to make an impact on that traumatic brain injury as it comes to reducing the swelling, which is huge. You want the blood flow to get up there to start healing, and then the bromelain with the natural healing properties. But really the road to our health is paved with good intestines. I really wasn't aware of this until I started doing my business and the health here, but our brain and our gut are derived from the same embryologic layer in fetal development. So the production of those neurotransmitters, they go both ways actually. The health of your gut and the microbes that are in there, they can travel to the brain. So necessarily if you have good gut health, you're going to have good brain health. And some of the experts even say that the gut is described as the second or the little brain, and I was not familiar with that either. But definitely as far as treating the gut, they always say, you know, that the saying that you are what you eat, or those gut feelings, they kind of take on a new meaning when you realize that your brain and gut are connected, and they really are. They're connected via the vagus nerve. So if you want to support your mental health and your cognitive health, and then balance those stress response too that you're going to have in a traumatic brain injury, you're going to look to the gut. You're going to want to try to heal that and make sure that you're getting positive neurotransmitters flying up to the brain. So how do you heal your gut? We have a few things that we use to heal our gut, being probiotics and prebiotics. We have quite a selection for adults and even babies and individual children. So they definitely are the heavy lifters in aiding the gut and overall health. And it's kind of come down to just one simple trigger, and that's the inflammation. It shows that the greater the inflammation, the more severe the mental complaints are. So we need to decrease that inflammation in the gut. The product for adults that we have that we're using is the Probiotics 10. It is unique in its benefits, and it works synergistically kind of to help and support the numerous areas of health. It's hard sometimes to keep probiotics on the shelf because of their active, the way that they are made and their active chemicals, but we use a live back technology, which is going to extend the shelf life of that product, and it eliminates the need for refrigeration of those probiotics. So it's really good quality probiotics that have a good shelf life to them, and you don't have to worry about how you're going to take care of them. We have one for little children because they do get TBIs just like the rest of us adults. This particular one here, the DNA Miracles Probiotics Extra, is for babies. You know, there's a lot of babies that have the shaken baby syndrome or are dropped on their head, which is just absolutely awful. But so they deal with the TBIs like everybody else. And so this formula here is going to help the little baby's intestinal health. they're necessary too for the child's proper and healthy development, definitely playing a role in their gut and their immune system. But these especially are made for our little babies. They tend to mimic breast milk. And then we move up to the children that are a little bit older, and we have the chewable probiotics. And these also use that live back technology to make sure that it's viable and market shelf available, so that it doesn't, I don't know what the word is I'm trying to say, but with regular probiotics, they definitely have to be refrigerated and kept in a controlled environment so that they stay in their form. But like I said, ours are the shelf life with the live back. It's much easier to use. We have floor melts, which are a prebiotic and a probiotic. They deliver the digestive and immune health, and you just sprinkle that on food. It can be used by adults or children, either one. I believe one of the best products that we have for gut health is called our Ultimate Aloe Juice. It really works in the digestive system for maintaining a healthy digestive tract. And it's definitely an overall health of the body to keep that intact. This aloe vera is processed in such a way that it preserves the natural properties of that aloe. So we receive the maximum benefits of it. There are 4 flavors. I tend to like the strawberry kiwi, and this is something that I put in my water bottle every day to try to stay healthy. It has over 200 nutrients, and it definitely helps with things like IBS or heartburn, and just has been shown really good results to help with those. So if we're healing some of that issues in our gut, again, we're going to be sending our brain good signals. And this is really easy to take. But I tend to wonder what would happen if we actually took better care of ourselves. Instead of when something happens and then all of a sudden we turn to whatever it is that we can find that will help us, including a traumatic brain injury. There are things that if you have them in your system, they've been shown to make better results when something does happen. One of those things definitely is magnesium. It really is good for the body. It's the blood flow. It increases the absorption to the body, and it promotes optimal muscle health and head comfort. So when you're thinking about a traumatic brain injury and the pressure that is involved, and the magnesium is going to give you some head support and make that blood flow to the brain. Magnesium is essential because our body, you can't synthesize it, you cannot make it, and so we need to take it. And our lifestyle factors tend to be processed foods, stress, and coffee, and alcohol. Those all deplete our body's stores of this essential mineral. So it's definitely important that we take it. And it also helps with the serotonin, melatonin for sleep and mental health. So you're going to get some of that in the brain, working on that relaxation again. I think those people that do take magnesium probably don't take enough. It's recommended that those over 30 for men get 420 milligrams and females 320. So we kind of have to watch as to the benefits and the symptoms if you're low in that mineral, because it truly is a whole body and brain relaxer. We also have a supplement that's called Prime Cognitive Memory Support. This is really huge when you're dealing with the brain, and it's going to help at maintaining that proper blood flow to the brain. And it's important in maintaining the proper brain function. It helps to enhance your memory and the mental activities. So in essence, it kind of keeps you focused and help you so you don't get overwhelmed. And of course, when you're dealing with a traumatic brain injury, everything is overwhelming, and you're dealing with memory that maybe isn't coming back like it should. And so our our cognition. It just affects the entire brain. And it's been known to even, the results have been seen within 2 weeks. So I think that that's pretty amazing for a product for the brain. One of our big players is Curcumin Extreme. This is probably one of the most important things for the body, and I know that most of us don't take it, and I hadn't either until I learned about it. It works with the inflammatory response, and it has been known actually to repair brain after brain injury. This is studies. It's not, you know, I'm not saying that it does, but these are the studies that have come out to have that curcumin in your body. It also detoxifies that body, so it's going to get rid of the inflammation. It has the glutathione, which is it's a master antioxidant, so in the human body. So it's going to preserve and protect the brain and other tissues from those free radicals. Definitely we want that for a brain that has been injured. So when you look at all the other advantages of curcumin, you definitely can see that it's something that should be used by everyone, but is really good for brain health after an injury as well. I believe that what we all should do as it comes to preparing our body in the event that something were to happen is we need to have a good foundation of minerals and vitamins within our body. And so we have what's called daily essentials, and it provides the source of the nutrients that we need every day. And the thing I love about these is that they come in a convenient pack, and they have 4 different products in them, as you can see on the slide. I should also say that the only difference between the Isotonic box and the Nutrimetric box is Nutrimetrics is our professional brand of the healthcare products, and Isotonics is what is purchased by individual consumers. They are the same product, they're just packaged differently. So we talk about that OPC3 like I did at the beginning for brain health as being a powerhouse. That is also included in the daily essential packets. So if you remember, it gets that oxygen to the brain and the tissues and improves that blood flow. So it's going to detox that area. Again, very important for overall health, important for gut health as well. That packet also will have a good multi in it. It's important to get those essential vitamins and minerals, especially since the food that we get now is not like we used to get. The farms are using pesticides and things like that. So we need to put in the minerals in our body that we're not getting from food. And our multivitamin has really great results. And it works on tons of areas on the body, and it has lots of things in it for a multi with, you know, the vitamin C and the B's and D. Definitely getting a big bang there for your buck. One other product that we have in that daily essentials packet is the calcium. So many people are short on calcium, especially women. And so we have a really good formulation. I did not know that it was so good until I was at a conference for chiropractors. And of course, they deal, of course, with the bone and bone health when they're dealing with the individuals that they treat. But one came up to me, well, more than one, and they grabbed the bottle and they looked at the back. And I asked them what they were looking for, and they said the salts that are in the calcium. And apparently most calcium products have like 2 to 3 salts. However, ours has 5. So they were very impressed and said that that is a top of the line because you just have a hard time finding that. The last product that's in the daily essential pack is our Isotonic Activated B complex. When you're talking about brain health, Activated B complex is huge. We have all of the B's in there. You hear about people taking, you know, getting a B12 shot or whatever, but our body needs all of the B's. So our brain needs all of the B's. We have B1, 2, 3, 5, 6, 7, and 12 in our B. And they are created clinically in such a way that it becomes a powerhouse of B vitamins, basically a superior product. So I can't help but think if we had this product in our bodies before experiencing a traumatic brain injury, if that would help things happen differently, maybe with healing, because it builds up that neurotransmitter in the body. So the omegas and the B vitamins, and then a product called Turnup, they all build up those neurotransmitters. I didn't share the Turnup in this presentation just because I felt like I was bogging you down with so many products, and I didn't want to do that. It does seem like there are a lot of products, but really they all have attention to the brain health and blood flow to the brain. I don't know if anybody has ever talked or shared about mutations in our genes. If you have the MTHFR gene, it can affect the body's ability to process amino acids and break down the essential nutrients, the minerals and the vitamins. So when you see activated B, that's going to refer that we have already broken that down. So for those people that have that gene and don't know it, it's bioavailability to them right away because ours are activated, which I really like because you need your Bs, and this is the best way to get them because they're already broke down for you. Our resveratrol is another powerhouse for product. It has there on the slide the maintain normal vascular relaxation. Well, when you're talking about a vascular headache, that's where you're, have the dilation or swelling of the blood vessels that cause a headache and pain in the head. So, those blood vessels, they become enlarged and distended and inflamed, which of course, when you have a traumatic brain injury, it's just going to be that much worse. So this resveratrol has been known to help with that, decreasing some of the symptoms of the swelling and helping to normalize those vessels and that throbbing pain that traumatic brain injury people experience. We have a product called Axe, and I know it's thrown into our weight loss supplements, but really it works on the brain. It deals with our adrenal, cortisol, thyroid, and stress support formula. And I know that people with TBIs have a huge amount of stress, and just trying to maintain that and trying to heal, they need some extra help, I think, with their system in helping that. And this really does, I take it, I can tell a difference. More relaxed, just not letting all the stressors get to me. And I think if we can get that brain relaxed for the TBI patients, it's a start to healing. Definitely is a good thing. We have the astaxanthin, which the isotonic property that we have here, it's been shown to improve the cognitive function in the brain, for sure. If you put the pycnogenol in the OPC3, the curcumin, which I just talked about, and the astaxanthin, that works on your immune system to keep the inflammation down. Again, inflammation is the huge thing in traumatic brain injuries, and we need to get that down right away so that we don't have a second injury and more stress on the body. It also focuses on tissue health and stable cell membrane. They definitely work with the cell. Some products work just on the outside of the cell or on the inside, but so vitamin C and OPC3, they work on the outside of the cell, CoQ10 on the inside, and curcumin, and I believe this astaxanthin work on both the cell, which is going to help for overall healing of that cell membrane. Two of our big players that we just released, I think it's been less than a year, are kennabiquin and thimonol. They work really synergistically together. Definitely a new formulation for things that are out there for brain health and overall health. You can tell by the chart that there are lots of things that both of those products help with, and it shows the differences in between them. But I can tell you from a friend who uses both of them that they work really well together. That kennabiquin is going to support the memory and cognition within the brain. It has thimonol in it, so it it definitely helps those emotions and that stressful situation that they're dealing with. There is full spectrum hemp oil, but I know people worry, oh, am I going to get tested and it's going to show that I'm positive for marijuana? No, you're not, because the hemp that we have in Cannabiquin is less than 0.3% THC. Those hemp products that you get from marijuana contain much higher levels of the THC. And so you're not going to get any kind of high feelings or anything with this. It's just going to help with your overall feeling and your mental comfort for sure. The Thimonol is a very special product. We have a cap and cap technology, which I've never seen before, ever. The black seed oil with the pinagenol improves attention and combats free radicals. So basically it's protecting that brain. That Thymoquin is going to be released first because that's going to reduce inflammation. And then the pycnogenol, which again is in the OPC3 also, it gets that blood flow to the brain. So it's kind of a multi-phase release of the products. And it definitely helps that brain with the two powerful products in there. It's a powerful antioxidant. It's going to help the body from the free radicals that exist and get that healthy blood flow flowing to the brain. Our vitamin D with K2 is a product that, again, I believe if we all had that in our system, we would sure have better luck when we end up with something wrong or a traumatic brain injury for that matter, because it's in all of our cells needed. It impacts every cell in our body, and it supports the elasticity of vessels. So you want those healthy arteries going to that brain. You want that blood flowing to that brain. Our K2 is put in there because it helps with the elasticity of those blood vessels, and so that the calcium does not deposit within those blood vessels, which would cause a heart issue, perhaps. So this with the K2 definitely is going to help with those blood vessels having enough space to allow the blood to flow and get to the brain as it should. It also helps to maintain our healthy C-reactive protein levels, which are inflammation markers in the body. Again, inflammation in the brain after a traumatic brain injury. You want to reduce that and get that blood flowing up there for healing. I put the anti-aging on here just because it is the most comprehensive product that I carry. It is not meant to be something that so you don't get older. It's to help fight as you go so that you end up healthy as you do get older. It's just it's a dynamic custom blend of antioxidants and botanicals and minerals, and it's formulated so that it helps support the brain and the cognitive health. So again, dealing with a traumatic brain injury, this would be something that could be used, or if it was in the body prior, perhaps could help the outcome. I can't say for sure, but definitely taking care of our body prior to such an event would definitely be helpful. What I was surprised to learn as I was doing the research is that our anti-aging has 20 milligrams of the carnitine. And in a study that they did, a double-blind study that was done, they realized that the effectiveness in 12 elderly patients, I kind of have it there, they had significant decreases in their memory loss and when they did mazes and things like that. So we have that in our product, and it definitely has been shown to help here older people, but I'm assuming anyone with the effects of brain and brain memory, which again, we're all dealing with a TBI. The thing I like about what I have to offer, and this mostly is for health professionals. I don't know if there's health professionals on the line, but they have the option of doing a gene Sniff analysis, which analyzes your DNA. They meet with a patient and they're not really sure what's going on, or they want to find out if there's anything that could have been carried from a parent over to them, like even being lactose intolerant. The DNA analysis that we do can help with that. It's just a personal genomics, And it doesn't diagnose anything, and it's not a prescription, but it definitely gives some insight to the doctors as to what they're looking for. It goes in, and it's not like other DNA analysis that may be sent to life insurance policies and things like that that are going to affect you and rates. This is all very confidential. It's a number that's put on the patient, and so no one ever knows. It doesn't go anywhere. And it's really a really good tool for doctors to use with their patients to help determine kind of what's going on in the system. The isotonic delivery that I've been talking about is one of the world's most advanced nutraceuticals. Isotonic means the same pressure, which is the same pressure as our blood, sweat, and tears. So what it generally means is that if I had an IV hooked up to you, you're going to get an IV solution going in that works much faster than any pill would. This is delivered, the bioavailability is like 98% within 5 minutes. It's going to just cross that blood-brain barrier. It's going to dump right into those intestines so that it can start working. Where if you take a pill form of supplement, that can take anywhere from 4 to 6 hours maybe to digest, if you even digest it all. And you're lucky if you're getting 15 to 20%. You can look, there's different studies that are done, but it definitely is something that makes a difference. I faintly recall when we were dealing right away with COVID that they were giving patients, I think it was IV supplementation, vitamin C. Well, our vitamin C is an isotonic form, and we don't need to have an IV hooked up to it. We just make it and drink it. So a lot of the other products have binders and fillers and chemicals in them. Ours are all natural. They are easy to take, and they are synergistic formulas, so they work well together in what they do. Scottie Pippen came to our company because he was having problems with his joints and wanted something that would help him be able to play basketball with a little bit less pain in his joints. And so we developed a product just for him, and I'm going to share just a bit about that later. As to my favorites, I do have the Prime Joint on there, which was developed for Scottie Pippen. It has hyaluronic acid in it, so it is really good for the joints. It lubricates those joints. And then I put on the OPC3 and the bromelain, which I said were two of the primary products for brain health. They really work synergistically together for healing. And my all-time favorite, of course, is the Ultimate Aloe. I put that in my water bottle and take it with me to work every day. And I'm getting the 200 enzymes that are in there and all the health products that are hopefully helping my brain in addition to my gut. The reason I love the three isotonic products is because in June of 2019, I had to have knee replacement surgery, and I stocked up on the products prior, and then after I got home, I started right back on them, and that's the results within 16 days. You can tell how the inflammation went down dramatically, which is what we need in that brain. The bromelain helped with the natural healing in the body. Again, healing those cells and activities in the brain. And the Prime Joint just to give me some fluidity in that knee. And I know this has nothing to do with brain health, but I just wanted you to be aware that the products are powerful. The range of motion I got back in 3 weeks, the PT person said he's never seen that kind of range of motion. And it's just because I was able to bring down the inflammation and start the healing process. So with that being said, it's just important to realize that it can happen to any one of us. We're not going to happen. You can fall, you can stumble, you can have a car accident, anything. But I don't think that we should let the concussions control our life. There are things that you can do. There are things you can do, hopefully, to keep yourself healthy before such an event would take place. Hope that it doesn't, but I think that you should just look for things that you can do to take better care of your health. If people have questions on anything that I presented during the slide, you can leave them and I can go back and review them later and touch base with you, or I can put the comments back in the slide here for people to see if they need to see the answers, or you can feel free to contact me by email, phone. I'll be glad to help figure anything out for you if something I said was confusing or misleading. I don't want that. I just want to try and share what I know that I have that definitely works very well with a brain injury. So thanks, Carly, for letting me share today. It was my pleasure to do that. I hope everyone is safe and well out there.
Yes, yes, you too. Does anyone have a question right now that they want to ask or type in? Or do you want to wait and contact her? Wait a minute here. No, not looking like it.
Not looking like it?
No? Okay, well, thank you.
Well,
that was
yeah, if something comes up, they can let me know. And I'd be more than happy if people just want like a wellness, even in their homes, to learn more about the products. I'm glad to do that. I'm glad to meet one-on-one with people or present somewhere at a physician's office if need be. I like to come into physicians' offices and work one-on-one with them and their staff to get products in, because their patients want to hear from them what is best for them and what they should be taking, rather than listening to a retail person at a store. So I'm more than happy to help. Just reach out to me.
Okay, sounds good. Thank you so much. Nice to meet you.